Hello, and welcome to Breaking Barriers in Collaborative Care, where we aim to bridge the gap between healthcare professionals and patients, providing valuable insights, discussing common challenges, and exploring innovative solutions. I'm thrilled to announce our guest for today is Meagan Buttle, who is an SLP, or a speech-language pathologist, who has been working in the rehabilitation field for nearly a decade. She owns her own private practice in Southern Ontario that is focused on medical speech therapy needs, including concussion, brain injury, stroke rehabilitation for adults and children. And her team at Buttle SLP also supports adult clients with voice therapy, swallowing, cognitive communication needs, progressive conditions, and other areas, including ADHD, gender-affirming voice care, and augmentative and alternative communication. She just does it all, folks. And she believes communication is a human right and strives to make SLP care as accessible as possible, with client-led and collaborative care at the forefront of her practice. So it sounds like every healthcare professional needs your mindset and needs to put that collaborative care at the forefront as we're trying to bring awareness with this podcast.
Well, thanks for the intro, Courtney. That's fantastic. I'm so happy to be here.
Yeah, thank you so much for joining us. When I first think of a speech-language pathologist, think of a very small scope of what I think we're going to delve into a bit today. But before we get into that fun stuff in the meat of what you do, would you be able to discuss what an SLP does for our folks at home who have no idea or maybe have never heard of one?
Yeah, absolutely. So when we say SLP, it stands for Speech-Language Pathologist, which is what you kind of commented on. And I think a lot of people, when they think of an SLP or a speech therapist, they think of somebody who helps with getting the words out or clear, right? But what we really are, and what we kind of, ironically, as a communication kind of focused field, have a really bad marketing for what we do. What we really are is more like a communication therapist. So if we think about communication in our everyday lives, it really involves kind of getting messages out into the world and also getting messages in. Right. So when we think about sort of anything that we do day to day, whether it's like picking up our phone to read a text message or scrolling on the internet or having coffee with a friend or, writing a list for your groceries, all of those things involve language and communication. Right. So it doesn't happen in a vacuum. So our role really helps people with any sort of difficulty with that communication. So it could be trouble getting that message in, like reading or understanding, or memory if they're listening to a conversation. It could be helping getting that message out. Maybe the muscles that help them make speech aren't working the same way, or they have a hard time finding their words, or maybe they have something kind of like what we would call a lisp or something along those lines, right? Or it could even be the cognitive pieces underneath communication. So being able to remember what your question was for me, right? Or make a plan or problem solve, or in a social communication setting, understanding sarcasm or dry humor or like faux pas, like being able to navigate those situations in communication. So that's kind of what our role looks like.
Wow. So a much bigger scope of practice, I think, than what a lot of folks, when they hear speech-language pathology, would kind of focus in on, which is amazing. Yeah. So you work specifically with children and adults, but I think more on the adult spectrum generally.
Yeah, more on the adult side.
But from early years right up until end of years, folks reach out to SLP for assistance in different areas and needs.
Yeah, so lots of people, I feel a lot of my colleagues and people that I know who are SLPs, we tend to find an area we're super passionate about and kind of dive headfirst into that. Some SLPs are amazing because they love everything and they're really great generalists is what we would call them. A lot of SLPs kind of pick an area that they're super passionate about and kind of focus their work in that pocket. But yeah, anybody sort of from 0 to 99 plus could be seeking support with communication. So we were chatting before recording started, but about a colleague of mine who only does infant feeding. So working with babies who have difficulty, latching or swallowing, or all the way up to sort of dementia care in seniors, things like that. Yeah. So it can be across the age range.
Yeah, which is amazing. Yeah. And just off the hop, if someone's listening to our conversation and at some point think, wow, I think I could really benefit from that type of care or know someone, how would they get in contact with a speech-language pathologist?
Yeah, so a lot of people, I think you need a doctor's referral. And I think sometimes if you have an extended health benefits program. Sometimes they do ask for one, but we're not required to have a doctor's referral to support clients. So a lot of people, if they're an adult, may see an SLP during time in hospital if they've been admitted for a stroke or brain injury. But really, it's a matter sort of looking up the SLPs who are in your area. And so the college we're a regulated health profession. So
that was a question of mine, so thank you.
The college that we're licensed by carries a registrar, so people can go on the college website and look up by region. The other really great thing to do is sort of look around or search by the keyword that you're looking for, because, like I said, SLPs work in different areas, can be looking for specifically what you might be looking for help with. So sometimes we get an inquiry for little ones who are having difficulty, picking up speech, or late talkers, as they often call them. And that's, while our clinic is trained to do that, most of our team are super passionate about other areas of SLP. So we often are also referring out to other colleagues and sort of sharing knowledge and information. But yeah, really it's a matter of finding, if you're in private practice, a clinic, calling them up and booking an appointment.
So you're already great at working collaboratively, and you're reaching out to who needs to
we try.
to.
Yeah, siloed care is really, really hard because, it's just, if you don't know what you need, then how do you seek the services you need? Right?
Absolutely. And that's been a big topic on this podcast so far is, finding those resources and connecting to them. So it's great when your healthcare provider that you're reaching out to can assist you with that and say, hey, great, you found me, but maybe this person or this resource would be better suited. So amazing. That's fantastic. Love to hear it. Since you did mention the fact that it is a regulated profession, before we talk a little bit more about what you do, how does one become a speech-language pathologist? What does that educational pathway look like? And what's your background?
How do you get there? Good question. So SLP is similar to other allied health professions. So we're kind of in the same realm or pocket as like an occupational therapist or physiotherapist. I think a lot of people kind of know that pathway a little bit more. Our degree is a master's, a clinical science or an applied science master's. So there's 7 schools that provide the degree in English across Canada, which is not that many.
No,
that's
quite small.
Quite small. The closest one to where we are is McMaster University, and there's a few more across Ontario. So in order to get into SLP, people do an undergraduate degree. They just have to meet sort of the prerequisite requirements. So we take courses that are similar to psychology or syntax, like how sentences work, how development works in the brain, anatomy and physiology. We learn a lot about sort of sound and acoustics. So if you're kind of interested in the soundscape thing, we'll do a little bit of that. And you kind of can come from a degree in a lot of different areas. I had classmates who did their undergraduate in, voice, like performance, singing, people who were teachers or a neuroscience background. I did mine in applied linguistics. So I sort of studied sort of like a combination of language, how language in the brain works, and psychology. And then I went to my master's and I studied at McGill.
Cool. Yeah. Wow, that's incredible. It's so interesting to hear how folks come into the roles that they end up finding their passion, and I think it's really neat to see kind of how those pathways work and lead to where you are now, which I would love to delve into a little bit about specifically Buttle SLP and your work and what you like to specialize in, what your focus is on, and how you help folks achieve their goals.
Yeah, so I started my practice, it'll be 5 years in July.
Congratulations.
Thank you.
That's
it's creeping
amazing.
up. Yeah, it's a totally wild ride.
Yeah, I bet.
But I actually came into brain injury. I have a personal connection to somebody who's experienced a brain injury. My dad had a motorcycle accident when I was applying to speech therapy schools.
Wow.
So yeah, he's doing really well now. Like back at work, everything's fine. He made a great recovery.
Okay.
But yeah, it was a lot of like learning that I wasn't even aware that speech therapists worked in this field because it's kind of a small pocket, the brain injury side when we're doing our studies.
Talk about like the stars aligning, like meant to be.
Yeah, it was very, very meant to be. He was attending a support group that actually we know somebody who leads one in Hamilton, but he was attending the support group closer to where he lives.
Okay, yeah.
And I went out to see there was a speech therapist speaking. And so I just sort of made that connection. And she was like, hey, have you ever thought about this? And I'm like, oh, okay.
Yeah.
So, that's kind of how I fell into it. And then, went out on my own, really passionate about supporting folks in functional rehab. So like getting back to the real world. Our team is really focused on making sure goals like kind of meet where the person is and not just, kind of worksheets or repetitive drill exercises. So like really figuring out like, oh, if you're really passionate about reading and book club, like that's a great goal. Let's figure out ways to get you there, or returning to learn or school or work. So that's a big area for us. And, I'm really fortunate to have an amazing team of SLPs who decided to join the ride with me. All of them come from amazing different backgrounds and have sort of different clinical focuses, but we've really decided, the medical kind of side, or like the acquired challenge side, is where we really love to support, and that's kind of taken off. So we've kind of kept adding things as people join, and they're like, I'm really passionate about stroke rehab, or we have an SLP who was a master's in opera performance before he became a speech path, right? Wild. He's super passionate about voice care, so we were like, well, then we're going to design a program and figure out how we can support where people love to, like what people love to do.
That's so interesting. That's amazing. And as you folks work within your clinic together with so many different backgrounds, how do you find then you work with other healthcare professionals? Where is the most common areas that you find you're meeting them for consultation, or
where's that overlap happen?
Yeah.
Great question. So a lot of times, depending sort of on the client, we come in at very different times in their process. So for some of our brain injury clients, we might pick them up sort of even before they're home from inpatient rehab. Some of them we see like 2 years after their concussion, because they're just starting to notice differences with their cognitive communication, which is the reading, writing, listening, speaking, memory, attention. It's kind of like an onion. As things get more complicated, they notice those challenges. So it really just depends on the type of client we're seeing. But I would say all of our clinicians are fairly involved in a team, no matter what the client looks like. So most often we're collaborating with occupational therapists, who are the ones who often kind of flag for referral, especially in community brain injury. Sometimes it looks like consulting with an ENT. We just, one of our team members just attended a voice clinic for an ENT assessment with a client, and they got to watch them do a stroboscopy and see the vocal folds, which was really, really cool.
Really neat.
Yeah, it was very interesting. And sometimes it looks like, collaborating with team members at long-term care, or I know you had a rehab therapist on your podcast a few weeks ago. We often work collaboratively with RSWs or RTs to kind of carry out those goals in community. It can look like a lot of different things, but we're often involved in those multidisciplinary or interdisciplinary teams for most of our clients, which is really, really awesome. And not something you would think about when you think about private healthcare.
Yeah, absolutely. And do you find it is more difficult to work collaboratively coming from a private healthcare standpoint, or are those doors open? Is it quite easy to navigate that and reach out to folks when you need to reach out to them?
That's a good question. I find it actually easier. So even though we're not like down the hall from a physio or an OT, because each sort of OT is supporting, like we're all working within a team, we kind of have that freedom to consult. So because we're seeing clients in community, we don't have a brick and mortar clinic. So we're always in home or telehealth. So we're in clients' homes and in their space and really working quite intimately, like in their environment, right? So a lot of it is kind of that trade-off of noticing like, hey, I'm noticing these challenges here. I'd love to reach out and call the OT and just give them that update, or something emotional might come up in sessions. So I may reach out and kind of give a quick update to social work and say, the client noted this, or they became really emotional during this task. Do you have a strategy I can use to support? Because what we sort of think about is, we're only there 1 hour a week. So care partners like family members or loved ones and the team are super important because we don't see them every day. So we kind of, by necessity, collaborative care is what we have to do, which is great. Like it makes life a whole lot easier.
That's amazing. I was going to ask, is there a way that collaborative care could be easier for you? But I guess it is quite...
Yeah, I mean, technology's made it a whole lot easier, right? So a lot of like Zoom consults or phone calls make it really great. I guess the more challenging part is if a client doesn't have like additional funding. So if they're paying out of pocket, that's probably the most often time we see like just a smaller team, because people have to prioritize where their funding dollars go. So in that instance, there's probably a little less collaboration just because there's barriers to accessing care.
Yeah.
But aside from that, we try to get a little creative in how we make that work. So, could be just having a quick phone chat or a text or consulting with a colleague, even if, getting the client's consent to say, hey, I'd love to run this by an OT colleague. Even if you don't have an OT, maybe I could kind of help figure out and triage what's most important, or make referrals and connections as we can. But there are challenges to it. Sometimes it's really easy and sometimes.
Of course.
Life happens,
Now, speaking about barriers to care, of course, the financial piece is going to be one. Now, when we're talking about SLPs, is this an area where there are an abundance of SLPs in Ontario, in Canada? Is this something that's more difficult to access? A few weeks ago, we had a midwife on, and that was a big barrier to access is the fact that there just aren't enough midwives, and that's an issue. Do you find that that's something that people are dealing with when they're looking for speech-language pathologists?
Yes, I think there's definitely an issue sort of in the number of SLPs we have. I know we were talking about that there's 7 schools in Canada. So we were just talking about this. We had a student coming through placement recently, and we were chatting about how, sort of out of those 7 schools, maybe the graduating class is somewhere between 25 and 50 people.
Oh, wow. So very small cohorts.
So small cohorts, which is great for learning. Really tough for having new people in the field. I also think there's just, a whole lot of world factors that changed what SLP kind of looks like. The pandemic being a huge one. So just challenges with access to school and some of the socialization. So a lot of the pediatric therapists that I know and love are dealing with, even in the private sector, really long wait lists, just because there's so many kiddos who need that support and there's just not enough SLPs to do it. So that's a bit of a barrier. Our team, because we're kind of in that urgent medical space, we try not to run a wait list for our patients because how do you say no to somebody and say I hear you're having trouble swallowing, we'll see you in 4 to 6 months,
right? Especially such a necessary thing you have to do, not just swallowing to eat and drink, but just
communication, right? Just sitting and not being able to communicate with people you love that's awful, right? So there's a big push kind of even in our field in the creativity department around using things like rehab therapists or assistants, like speech therapy assistants, support personnel where we can. Some populations a lot harder to kind of incorporate that because the skill set is really specific. But it's challenging. And I mean, even within hospital, there's very strict criteria about who qualifies for speech therapy. On the private side, we're a lot luckier because we can kind of, if the client's reporting challenges, that's a communication challenge. That's a goal, right? So if you're noticing a challenge or you're saying this is not where I want it to be, or I'm noticing a change, or I'm worried about my kid, or the watchful waiting kind of period is kind of over. They just say, seek a second opinion, ask, figure out if that works for you. But that's a barrier to care, is the number of SLPs and the funding aspect. It's challenging. It can be hard to have the money to invest in that type of therapy because our services aren't OHIP covered for adults unless you're kind of coming through a stroke care pathway.
Which is really unfortunate because there are so many areas, as now I'm learning, where an SLP can be crucial to a person's day-to-day life. So to not have that access is detrimental. Could be. And
so there's specific things that would be kind of covered, right? So needing to seek an AAC device or an augmented alternate communications, like an iPad to communicate. They have those clinics that are run through the hospital, things like that. And some kiddos, might qualify for services through an early years program or school-based rehab. But even the wait lists, it's so dependent on region. Geographically, we notice there's a huge demand and challenge for specialized skill sets or, more niche focus. So things like Northern Ontario or even rural Ontario, Grey Bears County or even, Norfolk County, there's really limited, there's just limited speech therapists. The city of Cambridge doesn't have a speech therapy clinic in it.
Wow. Yeah. And that's a bigger city now. Like
Yeah.
it's growing so much. So
Yeah.
that's quite surprising that an area that has so many people.
Yeah.
doesn't
So
have
there's
access.
SLPs who will service that pocket, but
Mhm.
nobody who's kind of has home base in there.
Wow.
Yeah.
That's quite surprising.
Yeah. So it's interesting where you see those like pockets of need develop, and we try to get a little creative if we can, offer group sessions to kind of reduce costs and burden, or if there's, there's some SLPs who run really successful grant funding for like community stroke-based groups. And so they're able to make it more accessible or find ways or sliding scales or, kind of partnering with a local charity or having students under supervision when they're confident and trained well enough to kind of take over and offer those either free or really reduced fee sessions.
Yeah.
It's complicated. It's a complicated problem.
Absolutely. And I do think that is an issue with privatized healthcare, is that access, and the fact that our provincial government here is really leaning towards the privatization of a lot of areas of healthcare. This is just another example of how that may not work in all areas. And having that as a sole option creates these barriers that if you don't have those financial means, you may not get the services that you need. And that's really upsetting. So if you're out there and you have a way to, talk to our government about, financial needs and services and healthcare, add SLP to the list, because they do amazing work, and it's really important work that it's really unfortunate that it's not OHIP covered.
Yeah. In some instances, right? So there's that like small pocket that is, and so many that aren't. So,
to get back on track of what an SLP does, because I'm very easily distracted when it comes to the social justice of healthcare. But that aside, what would a potential session with a speech-language pathologist look like if someone's thinking about working with one? I know there's so many different things that you do, but maybe we can talk about a specific issue, and then what
anyone that comes to mind
care
that
would
you want
look
to hear
like.
about?
I guess since we talked about it, the swallowing, that's such a big issue for a person to have. What type of exercises would you then be doing with an individual looking for assistance with that?
Yeah, so sometimes we'll get a call maybe after a person's had a medical event like a stroke, or even just like swallowing changes can happen for a variety of reasons. Could be, some sort of nerve damage or trauma. Sometimes clients have difficulty if they've been intubated with their swallow. Also, sometimes general aging can affect the swallowing, or other kind of progressive conditions like Parkinson's or dementia, where we're really, the safety is a concern, because if somebody's not swallowing safely, food can go into the airway. And what we're most concerned about is if that happens, like the development of pneumonia or aspiration pneumonia is a big risk for a lot of our elderly clients. So for us, it could look like an assessment. We come by and do a meal observation with them, look at how things are, moving and working. If they're able to manage safely, we can make a recommendation for a video fluoroscopy. So it's a procedure done in like an X-ray suite where they can give contrast, like food with like contrast, and they can see the swallow on a video X-ray and how things are moving, because we don't have X-ray vision, but if I did, my life would be so much easier. And we make recommendations based on that. So our first one's always an assessment, and then we sort of determine, are we safe to move forward, or do we really need to send the client to hospital to have it looked at further? And then it could be things like making recommendations about diet. Are certain textures safer than others when it comes to swallowing? Do we have to look at, liquids being a little thicker to make them easier to manage? Is the client, on like an alternate form of nutrition? Like, are they tube fed in some way? What are their goals? So if their goals are to eat with their family during dinner, food is such a social thing, and not being able to eat is like a huge part of that. And it could look like something like a strengthening exercise, so working on building those muscles back up. It could look at compensatory strategies, so other things we can do to make the swallow safer, while kind of always involving the client and the family into sort of what are the risks and benefits, and where are people comfortable with moving forward, because that's always a consideration, right? We can make suggestions, but at the end of the day, like, our clients are the ones in charge, and they can choose if they want to follow those suggestions, right? Or do that rehab program. Yeah. So that's probably like the most anatomy complicated side of what we do, is that swallowing piece. Yeah.
And then let's just say someone, I'm actually very interested. So gender affirming care is something I saw on the list of things you do. What would be an example of what that looks like? Because it's something I would have never have even thought of if I was listing everything that a speech language pathologist does. That just would have never even crossed my mind. And I think that that is an incredible service that can be offered for folks. And so, I'm really just personally like, how does that work? But I think our listeners or viewers, if you're on YouTube, hello. What does that look like?
Yeah, so gender affirming voice care can look like a lot of different things. So it can look, there could be trans or non-binary, gender non-conforming folks who are feeling like the way that they communicate, like their voice or their the things above communication, mannerisms. I talk a lot with my hands. The choice of words they use, how they deliver their speech, the pitch, the tone, the resonance can be very high and bright and light, or can be a lot darker and deeper. And so those folks who are feeling, dysphoria because of how their voice or their communication is, can seek support with an SLP to kind of, explore what that looks like for them. So it could be, trans feminine folks who might be looking for that higher, brighter, lighter quality. Could be, non-binary people who are sort of trying to find that androgynous feel to how their communication style is. So a lot of that looks like a lot of vocal play. We talk a lot about it as it's not sort of a disorder by any means. At that point, it's a lot of just affirming care. So we're sort of seeking, what about it doesn't work for you, and where do you feel your best, and how can we help you kind of achieve that piece with your communication? So a lot of it is having a really solid knowledge in voice care and voice work. So a lot of training in the anatomy and the physiology of how those mechanisms work, the musculature, and then, making sure you take that additional training from the gender affirming care or gender expansive care perspective to really ensure that, you're coming from that solid background, you're a safe space, you're somebody, it's a huge trust to put that into a speech therapist, to be really vulnerable in that space and try things out. But yeah, it can be a really rewarding, really safe place to try out those pieces and learn new ways of how to, make your instrument work.
I think that is an incredible service that you're able to offer folks that are looking for that, to help them feel comfortable with themselves and who they are. And as you're saying this, I'm like, I bet you podcast hosts would, do really well working with a speech language pathologist and figuring out different cadence and tones and things, and how you're communicating with your guests and with listeners.
Even like a vocal warm up can be something that's super, super useful right before you get onto even a long phone call, a podcast, or a meeting at work. It can be sort of learning ways to, optimize your voice to kind of, reduce the effort and just make things flow a little bit better and easier, improve your resonance. Lots of tips around like vocal hygiene and really interesting things we can talk about.
Vocal hygiene. Yeah. I really like that phrase. Is there maybe a little vocal warm-up that you could give us an example of, and maybe everyone who's listening can,
give it a try? Yeah, that's a good question. So we talk a lot about, like, the first thing could be really making sure you're breathing, you're fueling your voice really well. Like, our voice kind of comes from these tiny little muscles that are inside our vocal fold. They were whole vocal folds, but in behind sort of our Adam's apple area, they're tiny little muscles and folds of tissue. So it's just really kind of like, just like you warm up after an exercise, you can do stretching. So you can do things like a pitch glide or a roll. You can trill your lips. You kind of want to focus on feeling a good buzz behind or in that kind of front area. So it could be something like, or stretching and sliding like, and kind of coming up and down. Could be just, even as much as like stretching out your tongue or like sticking it out real far, feeling that. What feels good, right, is kind of the goal. Yeah.
Cool. I love that. Lots of sounds I make with my baby at home.
Yes, right? And that's the basis of communication. It's interaction, right? So copying, modeling, building off of the sounds that they make and imitating. That's kind of how we learn.
That's awesome. Yeah. I have honestly learned so much today, and I'm so grateful that you were willing to come in and chat with us. Is there anything that you wish folks knew about speech language pathology, that maybe there's a just something that folks don't know or a misconception, something that you would like to share with everyone listening?
Yeah. I think it's good to know that speech pathology or speech therapy is not just about speaking, right? So communication involves so much more than that. It's that message in, message out. It's, understanding, it's reading, it's writing, it's like social communication. It's sometimes with my clients, it's working on dating because that's social communication, right? Mm-hmm. There's more to it than just we hear this from a lot of our brain injury survivors. Oh, I talk fine. Like, I don't know why I'm being referred to. I talk fine. And then we can start talking about, can you follow along in a restaurant? Are you able to keep up? Do you tell the same stories more often than you mean to? Do you miss the joke? And then you're like, why was that so funny? All of those pieces are communication, right? So I think we automatically go to the extreme of a lisp or a stutter or after a stroke can't speak at all. But there's a lot more kind of nuanced pieces to what we do. Mm-hmm. And if they have questions, call up an SLP or email us. I'm happy, a lot of our job now is kind of providing those referrals for care and who makes the best fit. And for people who may have tried SLP and were not that I would hope everybody's ever disappointed, but if they try SLP and they're like, I didn't really feel like that was the right person, I'd say most of what we do is about the fit with the clinician, just like anything else, right? So being able to trust and feel safe and know that person's credentials, because not every SLP is made the same. Mm-hmm. I don't do infant feeding. I don't do preschool language, but I know great people who do. So don't be afraid to ask. A LinkedIn profile is great, or resume. You can always ask questions, and we're happy to help you find the care you need. So
that's awesome. And we will link information so that if you want to connect with Meagan or her clinic, you're able to do that. Again, thank you so much for coming and chatting with us. I think that this is going to be eye-opening for a lot of folks to learn what a speech-language pathologist does, and that scope of practice is so large. And I think that most folks can find an area in their life where speech language.
Oh, I can use a speech therapist some days. I'm like, I can,
Yeah, absolutely. So thank you again. And that's it for today. Join us next time as we continue to navigate the complex world of healthcare, where transparency and honesty are at the forefront here on Breaking Barriers in Collaborative Care.
Thanks, Courtney.